Hello, my friends. Welcome to another episode of A Sound Mind with Gloria, and I remain your favorite host, Gloria Odi. Today's conversation is a quiet one, but also a very important one, and we will be talking about depression. We'll do it gently, with all honesty and care. And if you're someone listening to me, you'll be asking yourself this question: why am I feeling this way? Why do I feel low? Why do I have low energy? Why don't I feel like myself again? This conversation is for you. So sit down, relax as we dive into depression, what it is, can it be treated, and all the questions that have been ruminating in your mind. This conversation is for you. I am joined by a medical practitioner who works with OEJ Ode Sickle Cell Foundation, and he is Dr. Tosin Oke. You're welcome, Doctor.
Thank you so much, Mrs. Gloria, for having me. It's so good to be here. I really do not take this opportunity for granted. Thank you all for joining us today on this conversation.
Thank you so much, Doctor. So straight to the point, in the layman's understanding, not some medical jargons that will scatter our head, something that everyone out there can relate, both male, both females, even young adults, they can relate to this. So in a simple terms, what is really depression?
Thank you so much for that question, Ma. So when we talk about depression, like she said, I'm going to be going very, very simply. So depression is can be simply understood by saying, I think it's best understood when we say when someone has low mood almost for consistently in a day, and then it happens over weeks. Like it's something that is not relenting. There are times where we have high and low moments, right? And then this person seems to be having consistently low moments or low mood all through in a day. And then this is not something that resolves on its own. You see it happening for 2 weeks or more. We can term that simply as depression. However, there is such a thing as clinical depression. Mm-hmm. Depression is a term that is commonly used now loosely by some people. Mm-hmm. For example, when you see a movie, you can say, oh, this movie is quite depressing. Does that make you depressed? Mm-hmm. Not necessarily. So when you look at the medical way of describing depression, what exactly do we call depression clinically? So there are different characteristics. There are things we look out for. Then having about 5 of these things. Now think of it as a cup. Then the cup has 9 papers, right? Mm-hmm. And then in those 9 papers, if I can pick 5 of them, 5 or more of those papers, and what you are feeling matches with those 5 or more, then clinically we can say you're suffering from what we call clinical depression or major depressive disorder. If you don't mind, I could go through the 9 or just take it in the future.
Probably for now.
Okay.
I think let's take it easy because of our audience.
Exactly.
So in simple terms, depression is not just mere sadness. It's not just mere one day low energy. It's something that goes on repeatedly and is affecting your daily life, right?
Exactly.
Yeah. So can you tell us, does depression affect the body or is just the mind?
Okay. So in a way, I think it might bring me or draw me to explaining those characteristics.
All right, Doctor.
Because when you get to know those characteristics, you'll see how that it affects not just the mind, it can as well affect your functionality, the body as a whole. So like we said, okay, so I'm just going to list the 9 very simply. One of it is when you have consistently low mood, right, over 2 weeks, like we said. And then the second will be what you used to enjoy doing. The person no longer finds delight in doing it. The person just begins to do it as duty, or the person is emotionally flat while doing that. That's number 2. The third one is the person begins to sleep excessively, or the person is actually not sleeping well. So it's not just I'm not sleeping. You could also be sleeping excessively. That's like the third. Then the fourth is either you're gaining weight or you're losing weight, right? Then the fifth is actually low energy, like you mentioned earlier. The person has low energy or fatigue. Then the thought process of the person, that's the sixth. The thought process of the person is slowed or delayed. You could even see it in the movements of the person. Maybe the person is kind of a fast walker and then the person begins to slow down. We call that psychomotor retardation. It's just everything slows down about you. And then another thing is a feeling of youth, lack of concentration. And then the last but not the least, which is also a very important one, is suicidal thoughts or suicidal attempts. So with all of these that I've mentioned, having 5 or more of this is what we term as clinical depression or major depressive disorder. So yes, back to the question, it affects the mind as well as it affects the body. Because looking at some of those things, when you don't sleep or when you don't have enough sleep, you know how it looks like. People can tell that there is something wrong with you.
Exactly.
So yeah, it affects the way you look eventually.
Yes. Thank you so much, Doctor. I believe our listeners can relate to this. If you're suffering from depression or you're not sure what is happening to you, but you know that deep within you don't feel okay, watch out for these signs. And even if you're someone who feels okay, and you have a loved one who you've been so worried lately about how the person is looking, how the person is feeling, or you are a colleague and suddenly you realize that there's this particular co-worker that has become withdrawn or is showing all these signs and the person is just pushing through, you could actually just spot this could be depression, because I don't think someone should rightly call a depressed stage depression. I think it's left for the doctors. You could have for the clinician. You could have all these signs, manifesting, but for us to practically say or rightly say this is depression, it has to be assessed by a medical practitioner. Thank you so much for this, Doctor. I want to ask a question, Doctor. Okay. Can someone appear successful or happy on the outside and still be depressed inside?
Oh, very well, sir. Very, very correct. There is such a thing as, we call it high functioning depression. High functioning depression in the sense that this person is doing everything. In fact, the irony of it is they could actually make life better for you. You could see them as they are the comedians. They are the strong ones. Like when they are outside, they are all good. They are the life of the party, what you call the life of the party. And then there are people you expect to be strong. For example, doctors, pastors, soldiers, parents. They expect that these people actually they are the strong ones. There really is nothing wrong with them. But these people, when they get to their closet, they still feel this emptiness.
Oh my God.
They feel this exhaustion. So yes, they are called high functioning depression. They could look good on the outside, but when you spot those signs, like we mentioned earlier, you could take the extra step and really ask, how are you really doing? Do you need help? And if possible, let the person see a professional.
And one thing again is that sometimes, or even most time, when you ask someone genuinely, like, how are you doing? I noticed this and this. Most response you will get is that I can handle this. I can handle this. I can take care of this. What do you have to say about that?
So really, I think when you look at it, that response stems from the fact that a lot of people have come to live their lives in such a way that they are really not sure if you can do anything to help them, right? So when you ask questions like, how are you doing? And then you get the default response will be, in fact, every one of us, our default response to how are you would be, I am fine.
Even when you're not fine.
Even when you're not fine.
You say, I am fine.
So that's really a problem. I think we should have someone in our life or someone we can trust that when we are asked that question, how are you doing? You should be able to say, it's not a sign of weakness to say, I am not okay.
And I think it's an African thing to just say, I am fine. The Westerner, they are always being honest with their response. They will tell you, I'm not okay. I don't feel good today.
Yeah.
They will tell you the way it is. But in Africa, we tend to just say, I am fine, when in reality, you are not okay. Can we normalize having a genuine response? Even if you don't want to come out ready to say, I am not fine, can we have a word that actually present how you're feeling in a very, very, should I say, calm, help me with the right word to use.
So I really agree with you. I remember having this conversation with someone not too long ago. And of course, in a spiritual setting, in a church setting, right? And then the person asked how you are doing. And the person was shocked when I said, I'm not doing fine. The person was expecting, okay, the literal, I'm okay, then let's get into the conversation. And then the person was like, why would you say you're not feeling fine? I said, yes, because I'm not feeling fine. Do you want me to lie to you? And then in the real sense, it now bettered the real honest conversation.
Yeah.
And then I had to let them know this and this is what exactly I'm feeling. So I feel we should also be patient enough, right? Because a lot of us ask how are we doing as a conversation starter?
Yeah.
Like, you are really not asking the question. You just don't want it to seem like, oh, why are you just jumping to what you want to ask me?
So the how are you just like greetings in Africa? How
like
are you?
greetings,
So the
how
next
are you
thing
doing?
is I am fine. You're not really asking to know
How the person is
I think
doing.
I have learned something. So I would the next time I ask someone, how are you doing?
I am really asking.
I'm really asking to truly know
how you're doing.
the state of mind you are. So I hope I get a genuine response.
Yes, and if you actually perceive that the person is not being sincere, maybe because of what you've seen, you
Yeah.
let the person know that this is not a conversation starter. I really want to know how you're doing. When the person perceives that you care, I think they will be willing to.
So I've learned something today. Thank you so much, Doctor, for that clarification. So back to you. I want to ask you this question. If someone is struggling, with all those symptoms you have mentioned, and doesn't mean they are failing, or it means that something needs attention.
So it doesn't necessarily mean you're failing. In fact, it doesn't mean you're failing. Whenever any of those symptoms are there, it just means something needs attention. Now, a lot of us, sometimes we mistake mental condition or mental illness as not really an illness.
Yeah.
For example, when you see someone who has obvious, what we all agree as physical deformity or physical illness, when someone is febrile, when the person's body is hot, you can, even if the person tells you, I am fine, you don't consider it, as a weakness. You can tell that the person is not fine. And then there is something wrong. Fever shows there is something wrong
in the body.
So when you see all of those signs, it just means there is something wrong.
Something is wrong.
There is something wrong.
Something that needs attention.
That needs attention. So you don't just let it slide.
Yes.
You actually pay attention to it and address the matter.
Yes. So something just resonated with me as you're talking. We still have people, like you rightly say, who truly don't believe in mental struggles or mental ailments, but they believe that the body can get sick. And the body and the mind, they work hand in hand. You cannot separate them.
Exactly.
So I want to ask this question, buddy, to our audience, for those who don't truly believe in mental struggles. Because when you don't believe in mental struggle, how do you help someone who is going through that challenge? And how do you even identify when you yourself, you are having those issues? Now, you believe that your organs, your heart can have a problem. You believe that the kidney can have a problem. You believe that the liver can develop a fault. You believe that the lungs will have a problem, and there are machines to diagnose all those ailments. Then what makes you feel that the brain cannot get sick?
That makes me even remember the WHO, World Health Organization, their definition for health. According to, I think it was in 1948 when this definition was actually given, that health is a state of complete physical, mental, and social well-being. Complete physical, mental, and social well-being. And not just the absence of disease or infirmity. Like, you have to be whole mentally. That is health. So it is not just when my physical body is not healthy that I am not healthy. Right? So when your mental well-being is not in place, then you are really not healthy.
You're really not healthy.
From that definition of health.
Thank you so much for that, Doctor. And we're riding out. Can you just briefly, I know that we have so many major causes of depression, but from your own perspective as a medical doctor, could you just briefly tell us the major causes of depression? Because once you know what can cause, for instance, now we've been told that malaria, you can get malaria when you're bitten by a female mosquito. So we understand that we need to sleep in mosquito nets, or we need to fumigate our houses, use insecticide to prevent us from getting malaria, right? And other physical ailments. So what are the causes of depression? When we know these causes, it will help us to identify from afar, okay, if I do this, I could get depressed. I could suffer from depression. So what are the causes?
Thank you very much for that question, Ma. So concerning depression, one thing about depression is that it is multifactorial.
Okay.
What I mean by multifactorial is sometimes it is hard to say this is that one cause of depression. There are many things that play a role, and you could classify it into, it could be genetic. There could be a genetic cause that is transferred from family. If there is an history, if there's an history in the family, there is a possibility that someone also might suffer it. Or if we call some people twins, right? So if a twin suffer it, the other person can also suffer it. So it's genetic in nature. It can also be biological in nature. There are some good hormones. Hormones are like messengers in your body. There are some good hormones that make you feel good. Like we said initially, how that depression is all about your mood, right? Those hormones, like, you must have heard of dopamine before. You must have heard of serotonin. Those are good hormones. So when there is a problem with those hormones in there, then it could also lead to depression. Then there is the environmental factor. For example, people that suffer major life challenges or major life issues, for example, a loss, or someone who undergoes or someone who underwent a form of abuse, either in childhood or someone you trust, there's this form of abuse. There could be that environmental, also stress, right? So people who are going through some level of stress, chronic stress, it can actually predispose one to depression or psychological. So looking at all of this, let me just explain this simply in a way you can, understand. Think of it as two cups, right? So in these two cups, let's say this cup is 3/4 full, 3/4 is almost full. And then this one is just 1/4 full, right? If these two cups represent two people and they are both exposed to the same level of stress, this one that is 1/4 full, 1/4 full, the same level of stress might not let you get to the brink where you're actually depressed. But this one who is 3/4 full, the same level of stress this person was exposed to can lead to depression for this person. And they were exposed to the same level of stress. But this one is already predisposed already. There is all those factors we mentioned earlier. They were there already. So being exposed to the same level of stress. So I think this brings us to where I think we should be gracious with our words. Because you'll be like, I underwent the same thing. We went through the same thing, but this person already have a predisposition to depression. And then it just takes a little more stress to actually be depressed.
To actually put him in that state where we say someone is clinically depressed. So if depression is biological, and I also feel, even though it's biological, you as an individual can tell yourself that, okay, I know this thing runs in my family, but I will not get depressed. I will not inherit it. So there are things that I must do to avoid getting to that state, since I know that it runs in the family. Just like diabetes. Diabetes runs in the family.
But someone might not have it despite.
Yes, because you have chosen a healthy lifestyle.
Exactly.
So it's the same thing with depression. Even if it runs in the family, you can choose a healthy lifestyle.
Exactly.
That's why we are creating this awareness. So it doesn't take you by surprise. It doesn't take you unaware. It doesn't take you unprepared. You're guided. You know that, okay, if I expose myself to high level stress, I can get depressed because this thing runs in my family. All right, doctor. So let's talk about the hope and treatment, because now my listeners are able to identify what could likely cause depression. They are aware that on how to look out for themselves. Now, for someone who is already suffering from depression and is asking what is the way out, how can I get help? Because we've been talking about getting help, getting the right help. So someone will be asking, how do I get the right help? How does treatment looks like? It's very important for our listeners. So this question is for you, doctor. How does treatment usually look like? Can depression be treated? Is it a terminal ailment? Can the person get help? Can someone be free again to live a thriving life?
All right. So unlike some other conditions, some other disease condition like hypertension, where you say you have to live with it all your life and all, depression is unlike it. It can be treated. It's something you can totally come out of, right? So there are different methods and approach to treatment. And I think it's best for me to classify it that way so it will be easier for us to understand. And one of it is lifestyle.
Okay.
So lifestyle will include some something as simple as exercising regularly. Right? There's something it does to your mind. There's something it does to your brain. Walks, occasional walk, jogging. Like it releases those good hormones we talked about earlier, the dopamine, the serotonin, and all of that is responsible for the way you feel.
All right.
So when you take time to exercise frequently, right, you would actually feel a little better. Now, depending on the stage the depression is. So lifestyle changes like exercise. Another example of lifestyle changes will be diet, what the person eats. You know, one of the, if you remember the 9 characteristics we spoke about then, we said one of it is excessive eating, right? Or excessive adding of weight or losing of weight. When someone is depressed, one of the things you see they will do is they begin to crave sugar a lot.
Okay.
And so in cases like that, you will be much more intentional about your diet. So yes, of course, the body needs glucose to thrive and all, but not the processed sugar like you want to take. You know, when you don't really feel like it, you just want to grab onto any snack. You want to take anything that doesn't really look healthy. So you're much more intentional about your meal and how you eat. Eating well, eating balanced diet, it is very important. Another thing is some people resort to, you know, taking substance, alcohol, smoking, whenever they do not feel okay. Now that is
To
not
get
helping
high.
you. Exactly.
I usually see people say, I want to get high.
Exactly.
There's this feeling I'm feeling. It's only alcohol that can numb it.
And
So,
that
and
is-
it's actually the wrong method.
that is the
It's actually a wrong
method.
coping method.
mechanism.
Yeah.
It's like she said, it's coping, but it doesn't solve it, and it's a wrong one at that. So it's not something you should try in any way. Resting well also. So that's about lifestyle. But besides the lifestyle, there are also there's something we call psychotherapy. Right? Psychotherapy is like you need someone to talk to. That's where community comes in. But in the professional setting, there is okay, permit me to use this word, but I'm going to explain what it is. There's something we call cognitive behavioral therapy in medicine. And what it means is when you sit with a professional, they want to, it's not positive thinking. They want to help you process your thoughts. There is something we know that, there's a way the Bible puts it, as a man thinks in his heart, so
he is,
So there is a wrong thought and wrong
thought,
perspective.
yes.
So there needs to be some form of discussion with a specialist that helps you process that thought, get to know what is informing that thought, and then that thought is changed so you can actually live right.
So that means it's not, there are people who are trained
Exactly.
to handle the mind.
handle that.
It's not everybody you have conversation with. It's not everybody that can help you. You need to get people who are actually trained to handle issues of the mind. Another thing you talk about is in that psychotherapy, they teach you how to reframe your thoughts.
Exactly.
Now, I understand that the brain doesn't know what is right and what is wrong, but what is repeatedly fed with, that's the direction it will go.
That's exactly.
So in psychotherapy, they teach you how to reprogram your brain.
Exactly.
And I think that reprogramming is not a one-day event. It's a lifetime. So your brain will start changing patterns to what you are repeatedly thinking, what you are repeatedly reading, what you feed your mind with.
Exactly.
Please go on, doctor.
Yes. So besides the cognitive behavioral therapy, one of the psychotherapy, there is also interpersonal therapy. Right, that's where community come in. Now, cognitive behavioral therapy needs to be done by a specialist. So interpersonal relationship, how you relate to people. You know, sometimes a lot of people want to be alone. You just have this feeling of, I want to be alone. Whereas, despite having what you really want, which is being alone, you know you are lonely.
You're lonely.
So there is being alone to actually refresh, to rejuvenate. But it is not to the end that you become lonely.
So being alone is different from loneliness.
Yeah, from loneliness.
From loneliness.
So someone who is suffering depression can actually, it's in a way, it is loneliness.
You're lonely.
Loneliness.
You
You
feel
can even
lonely.
be in a community and you're still
And you're lonely when everybody is vibing,
Exactly.
gisting, but you just feel this. You don't have the strength to participate in the conversation.
The low energy.
You don't have the energy. So I think we need to be more compassionate with people. It's not that they are lazy. They are not lazy. When you see them lying all day in bed, you feel you this lazy girl. It's not laziness. They are struggling with low energy.
Thank you so
That
much.
energy that you have to get up, they don't have it. It's just like a battery.
Yeah.
A battery, if I may put it this way. When your battery is full, it reaches 100%. You might be at 100%. And somebody who is depressed, his energy level will go down low to 20. And in some phones, when the battery is less than 20, it shows red, and that's danger. Yeah. So you don't expect the same performance from someone who's at 100% and someone who's at 20%. That person is struggling with low energy. The body is not producing energy to fuel that person's daily activities. So the person is not lazy. The person is not avoiding work. No, something is happening to the person that needs medical attention, which has rightly said, psychotherapy, your dieting.
Yeah, and then there is also the treatment. Like with medications. There are drugs that are given. Now, it depends on the level or the severity of the depression. Remember, there is mild, moderate, and severe. And in those cases where psychotherapy doesn't work, we actually prescribe medications. There are different classes of drugs that are used. I won't bore you with those jargon, but there are different classes of drugs that can be used actually. And then in more severe cases, right, in cases where a lot of people have been using drugs and then they are not getting better, there could come a time where the specialist who is trained would actually recommend such a thing as, we call it electroconvulsive therapy, where this is a medical term. It is for more severe cases. So just understand electroconvulsive therapy that is also used as a form of treatment in severe cases. But you don't have to get to that point, right? At the early phase, when we begin to have this, your lifestyle, right, as we mentioned, psychotherapy would actually produce results. But if you leave it and not address it, then you now begin to see that those things does not work for you anymore. It begins to deepen.
And I'm so glad you talked about a medication. Now, to that, I realized that even when we have physical ailments, when we are being given medications, halfway we stop. Once you just feel better, you stop your medications. So please, let's take note. If you're suffering from depression and you're being placed on medication, and before your doctor will place on medication, you would have diagnosed that you have depression, and he would have gone into talking with you and would have prescribed a medication. Please follow through with your doctor. Because I realize people have a relapse because they don't take their medications. And I also understand that for different depressive states, the length of medication differs. So don't compare your own treatment to somebody else's own. You can be on antidepressant for even up to 6 months.
Very true.
Even up to a year. So you have to exercise patience. Thank you. So
fit to,
until you're fit, and the doctor that will certify you fit and say, okay, for now you can stop this medication, but you don't just stop outrightly. So when you're seeking for help, please seek for the right help. Go to hospital. The doctor, they are trained and they have specialists. They know where to direct you to. Thank you, doctor, for that. So we are coming up to the end of today's talk show. I want you to say something to our listeners, because yes, some are afraid to get help and they are listening right now. Some are hesitant. I want you to say a final word that will lighten the hearts of our audience.
So I want you to know that depression is actually real. And then being afraid doesn't necessarily mean that you don't need help. Right? And courage doesn't necessarily mean you are doing something without fear. Courage is doing something in spite and despite. So I could have fear, I could be hesitant to get help, but courage is, oh yes, I have the fear to ask for help. I'm hesitant, but I do it either ways. So depression is real. It's not a weakness. It is just because you are human. And anybody, some people can feel, I told you that even health professionals, sometimes actually we go through this.
Of course, because they are humans.
They are humans. So no one is actually immune to it.
No one.
The fact that you have those symptoms, the fact that you're feeling those way does not make you any way lesser than anyone.
It doesn't.
Right? In fact, it is strength when you actually seek help. You're not meant to bear it on your own.
You are not meant to
bear that burden on your own.
And I think we need to normalize it. Just like the way somebody can say, I have malaria, I have this. You can normalize so that you can get help. Let's not die in silence. See, once the mind is distorted, honestly speaking, you won't be able to live a life. That's the reason why so many people are struggling. Struggling at work, struggling in school, struggling keeping a home together. They are just literally surviving, but you can actually live a thriving, yes, you can actually live a thriving life. Thank you, Doctor, so much for spending your time with us and sharing your insight. I must say that I have learned so much.
I have learned also from this conversation.
with what I have right now, depression, you will never see me in Jesus' name. Never. Amen. I'll take care of my mind. Yes. I'll take care of the places I go to. Exactly. I will ensure I'm in the right community of people. I will ensure that I take good care of myself, know what stresses me, know how to handle it, exercise. At least he said a walk. Yeah. Even if I cannot jog, I can just take a walk. I'll have good conversations. I wouldn't bombard my mind with the happenings around the world, the negative happenings. I feed my mind on healthy things because I truly, truly want to live a thriving life. Thank you for sharing your thoughts with us, Doctor. We're grateful. And to everyone listening to me, I want you to have these thoughts as you leave this space, this moment. Please know this. You don't have to go through it alone. Help is available. And your life matters. Until next time, please take good care of your health. Always pray. Always stay in a positive environment. Always surround yourself with people who see the best in you. And also you see the best in people. Be careful with your words. Let be human. God bless you and I love you.
Yeah, how do you do that? Yeah, this. Love you all.
I love you.